Hi, I'm Kelsey Higdon. I am joined today by a neurologist at the Baton Rouge Clinic, Dr. Gerard Dines. Thank you for joining me today.
Thank you.
So we know that migraines affect millions of people worldwide. Can you tell me what the difference between a migraine and a general headache is?
Sure. Migraines have a lot of specific qualities to them. There can be so many types of different headaches, from muscle tension to sinus or caused by medications or other things. But migraines are a specific type of headache that occurs over and over again. It's certainly not uncommon and probably underdiagnosed. Even 12 to 15% of people have some degree of migraines. But it's a pattern. They can occur anywhere from once every few months to even every day. And they tend to be stronger and quite intense, often one side, but not necessarily, often with symptoms like nausea or light or sound bothering the person, but not necessarily. And they can often run in families, more common in women than men. But you're always on the lookout when people have headaches that have kept coming for weeks to months or years, that these could be migraines. Even if sometimes they seem more like sinus or neck-related headaches.
Yeah. So as we know, migraines can be debilitating for people who suffer from them. What are some effective treatments that people can utilize not only during an attack, but also preventatively?
Migraines can indeed be debilitating. In fact, many people miss work. Migraines often make it impossible to function during a day, so people often just lie in bed in a dark room. But there are a number of treatments, especially over the past decade, that have come out to knock it out. Most people take over-the-counter medicines, but many times that's not strong enough for migraines. So there are prescription medicines, and you can take too many over-the-counter medicines. So sometimes if you're not knocking it out with your usual Tylenols or ibuprofens, you want to try to get a medication that can knock it out. There are the older medicines that have been around probably over 20 years now, like sumatriptan or rizatriptan, medicines like Imitrex, Maxalt, and they're very good and they're very effective. And then there are a host of newer medicines now that sometimes you see commercials on TV, which are also very effective, even a few less side effects. Of course, some of the challenges with newer medicines is whether insurance will cover the cost of the medicine. But all total, there might be 10 or 12 different migraine prescription medicines that if the over-the-counter medicines aren't helping, that, could work for you. Maybe not all of them are for you. Some of them you might not tolerate, some of them may not work, but with a number of them, working with your doctor, your primary doctor, your neurologist, you should be able to find one that really knocks it out.
Okay, and so what are some different lifestyle changes that one could make to maybe decrease the frequency and severity of their migraines?
Yeah, there's two ways that we approach headaches, and one is certainly to try to find something when you have a headache to knock it out. And then the second is preventing. Now, some people are fortunate enough, if they have migraines, again, to only need medicine maybe twice a year. But there are a lot of people that they're more frequent than that. And so you're going to examine your lifestyle, and it starts with diet. Now, a list of all the foods that could cause migraine would cause you to deplete everything fun and exciting from your diet. So you don't want that. But maybe you can identify one food that seems to really do the trick. Maybe it's cheeses or chocolates or alcohols. Maybe it's pizza or Chinese food. Not everybody are triggered by these things, but if you say, wow, every time I have pizza or every time I have red wine, I have a headache, then that could be it. Certainly exercise, regular sleep is important. And we find, in addition to the usual triggers of hormones or stress, or foods, that weather can trigger it. And many times barometric pressure shifts, these storms we get every afternoon can trigger it. In the hot weather, you definitely want to stay cool. You definitely want to stay hydrated. Sometimes you can do all of that and it doesn't work, and you wind up having headaches 3 times a week. And in that case, there are actually other types of medicines that can prevent headaches, that can make your headaches less frequent. So sometimes you can do everything you want. What you don't want to do is you don't want to take 3 or 4 times a week Tylenol, Advil, or even the prescription medicines your doctors give you, because that can actually lead to those medicines not being effective, or even increasing headaches, something called rebound headaches. So again, that's something to talk to your doctor, your primary, your neurologist, and there are some other medication options that you can take on an everyday basis to space the headaches apart and make them more manageable.
Now, individuals may not know when it's time for them to go and see a neurologist instead of seeing a general practitioner or taking those over-the-counter medications. So how can an individual decide to schedule an appointment with Baton Rouge Clinic, and what steps can they take?
Sure. The first step is always discussing with your primary, because that's always going to be the easiest to get in with. And again, the vast majority of medicines probably will respond to that first or second medicine. But you may find that you've tried a few options, you've talked with your primary a few times, or the headaches are just increasing in frequency, or getting you in general nervous and scared. And so that would be a good time to ask your primary, hey, would this be the right time to go to a neurologist? Of course, anyone can make an appointment with a neurologist on their own. Sometimes they're a bit tougher to get in with. There's not as many as internal medicine doctors or family practice doctors, but I think they're always available, and we do see probably the number one diagnosis a neurologist sees is migraine headaches.
Really?
Most times frequent headaches. Most times they are people who have tried one or two medicines already. So I think after several medicines have failed or the headaches just don't seem to be getting better, I think a neurology visit would be appropriate. And again, a person can make that on their own by calling the Baton Rouge Clinic or asking for a referral from the regular doctor.
Thank you so much for joining me today, Dr. Dines. That was very insightful information. If you'd like to schedule an appointment with a neurologist at the Baton Rouge Clinic, just give them a call, and remember, support local.